Maria, I'm so excited to have you, and I would love for you to share a little bit about yourself and the work that you do.
Yes, thank you for having me, Jordan. It's so nice to see you again. So about me, I am a bilingual speech language pathologist. I've been a speech language pathologist since 2008, and I have been in a lot of different settings, but I ended up focusing on cultural and linguistic diversity and specializing in the assessment of our culturally and linguistically diverse clients. And I started Layers Consulting in October of 2023, so a little over 2.5 years ago, or almost 2.5 years ago, to create a space where we could come together and learn more about cultural and linguistic diversity and best practices. Because the way I practiced when I first graduated is not the way I practice today. There's a lot of new techniques and new information about how we can better serve these populations.
Thank you for sharing that. I love that layers. I feel that it's such a reflection of just sometimes when we talk about bilingual, there could be so many different aspects to it. So, on that note, I have a question regarding when children, let's say, are learning two different languages, let's say in the home. What can you explain a little bit more? Like, is there a way that's more effective, like having one parent talk in one language, or what have you seen in terms of the work that you've done?
That's a great question, and that's one that
Yeah.
comes up all the time. And often I've heard from people who are just not yet informed, don't speak more than one language because it'll confuse your child, especially if they have a language disorder, or one parent, one language. And that's not necessarily true. You want the child to be getting rich language input, period. And it is also not true that a child who has a language disorder is unable to learn more than one language. They're equally able to learn more than one language. And there are lots of people all around the world who speak multiple languages, not just two, but many. Also learning more than one language doesn't cause a language delay or language disorder. So kids don't get confused. People, adults maybe do when they're learning languages, but kids don't. So it is perfectly okay to speak more than one language in the home. And the advice that I give parents a lot is use the language that you're most comfortable using. You want rich language input. So do what's most comfortable and feels most natural to you.
As a parent, even though my kids aren't bilingual, that I imagine is such a relief for some parents hearing that if they do have bilingual or even trilingual households, because I didn't realize either too about because there are so many a lot of conversations surrounding if a child is delayed in their speech to only go to one language. So can you talk more about how do parents even figure out if their child has a delay if they're speaking both languages?
That's also a really good question. And I think this is where our clinical skills come in as speech language pathologists, and also finding somebody who is trained on the current best practices, because it's not an easy process to determine if a child who is learning more than one language has a language disorder. So it requires some additional training and additional, taking courses and developing those clinical skills to help you identify. It is certainly helpful if you speak more than one language as a speech language pathologist to help determine whether a child has a disorder or not, but you don't have to speak another language or the language that the child is speaking to determine a disorder. And I think, learning how to work with interpreters is very helpful, but also understanding the impact that other language has on English to determine what is a normal impact and what might be disordered. And that will come through in how the language is used. And I also want to say it's really important for us as speech language pathologists as a whole to be trained, especially if we're working with these culturally and linguistically diverse populations, because we our profession does not reflect what the population we work with looks like. It's getting better, but it's been a slow process in recruiting more culturally and linguistically diverse speech language pathologists. So it's important for all of us, even if we are not from culturally or linguistically diverse places to learn how to do this because it's best practice and we're doing a disservice to our clients if we don't.
Wow, I I have a lot of questions, but one that comes to mind is you are still seeing clients, and also you are training other. Is it only speech language pathologists, or do you have other disciplines that are coming to for your support?
It is mostly speech language pathologists, but I do often work with organizations like school districts or departments of education, sometimes private practices to help them understand how to best approach working with culturally and linguistically diverse learners. But at this point, I would say yes, it's mostly speech language pathologists.
Okay, and so you've been on a few different sides. So you said in the beginning when you started practicing, you wish you had more of the information that you're providing to other professionals. And then also, too, you're still practicing with your private practice, seeing students. So what's something that you're finding that is, there's a lot of myths, but what is one thing that surprised you as you have furthered your career and found more information through what you do?
Well, let me say first, the reason why I still practice, I still see clients, it's not a lot, but I do it because it keeps my teaching honest, because I know how long things actually take. I'm not just saying, oh, it's so quick and easy, because changing your practice is not easy at first, right? It's hard and it takes work and it takes extra time. But as you get better at it, it becomes easier. And then in terms of what I wish I had known, um, it's it is hard when you're a practicing clinician to keep up on the research, figure out how you're going to implement that clinically. So that's kind of where I come in. I want to fill in that gap. I look at the research, I look at what it looks like clinically, and then I try and give that information so that we can more easily implement best practices into our clinical work.
Interesting. And what about assessments? Because you said specifically you really focus in on assessments. How do you see assessments changing, like compared to when you first started in this field and being more aligned to a student's primary language?
Well, when I first started, I remember my first like bilingual assessment team job. I gave so many self for Spanish, like all day, every day, or PLS 5 bilingual, all day, every day, and just reported scores and made decisions, a lot of decisions based on those scores. And I really do wish I could go back and change a lot of what I did back then because it is like almost the other side of the coin right now. It's a lot of dynamic assessment, so not necessarily reporting standardized scores because we learned that these tests don't have good psychometrics. They're just not good at identifying language disorders in multilingual speakers. And I also learned that one of the myths that exist out there, well, it's not a myth, it just depends on where you are, but that standardized scores are required. And you can put enough evidence together to show that they either do or don't qualify based on other kinds of data, based on observations and interviews and results of dynamic assessment. You don't necessarily need standardized scores to prove or disprove the absence or presence of a language disorder.
That's really interesting. And when you say dynamic assessment, and maybe this is something more that you would just need to come to layers to find out, but I'm not as familiar with that term. Is there like a quick way you could explain it?
Yeah, it is test, teach, retest. So you get a baseline of where a child is performing. You teach them skills and see how they respond to support and how much support they need. And then you retest to see what they can do with those strategies that you've taught them. So instead of like a static assessment that looks at one point in time, which relies heavily on prior learning and also test taking ability, which not everybody has, cultural experiences, language experiences, you can bring in all of these culturally responsive ways to learn about where a child is during that teach portion so that you can understand what is having an effect on their ability to learn and how they learn. And also, it's much better at identifying the presence or absence of a language disorder.
All of this is fascinating. I remember years ago, just to your point, even about feeling prepared. I did not feel prepared. And I remember there was this one case in particular where it was hard to find an interpreter in that specific language that the child spoke. And we were, using a lot of different outside resources to find an interpreter. So looking back in that type of scenario, what would you say, like, what do you do in those types of scenarios, when there's a language and you're trying to find a specific interpreter? What are some of the different strategies or ways that you're able to navigate?
I think it really depends. I know a lot of it depends on where you are. I'm in a
Yeah.
metro area, so it's a lot easier for me to find interpreters for less spoken languages.
Hmm.
There are phone options. If there
Hmm.
is not a lot, if there are not a lot of interpreters in your area and you come across a language that isn't represented either with somebody in person or within the organization that you work with, there are phone options that you can use. And it's not the best, but it's better than nothing, that's for sure. And then back to dynamic assessment, something that I really like to incorporate is word learning. And that's when you incorporate teaching non-words. So a word and an item that the child may have never seen or heard before. And you don't really need an interpreter to do that, right? It's a new word. So helping figure out if a child can learn a new word and how they respond to that support. Uh, Maybe you don't need an interpreter for every single piece of that. Now, it also depends on the level of language. There's a lot that has to be considered there. You don't want to always go around doing things without interpreters, of course, but there are different things that we can do when we don't have access to the resources that we always need.
This has been really interesting to be able to like learn more of the different things too that we may have thought otherwise, and you shared kind of some background information too about that. But how can people find out more about layers, or do you have any upcoming events, or what's the best starting point?
I do. So I can share my screen, right? I think I can.
Yes, you should be able to.
Okay, so I'm sharing now. Hopefully you can see my screen. This is what our community looks like. We have events here, and then you can see some of the upcoming events there on the right side. We have a cultural and linguistic diversity peer advisory group. We have cultural and linguistic diversity workshops where we discuss some issue related to cultural and linguistic diversity. A recent one that we had was on narrative structures in different cultures. So we're not misidentifying a different cultural storytelling pattern as a language disorder. We've had one on culturally responsive goal writing, on implementing different dynamic assessment procedures. So we do a lot of that in our workshops. And in our peer advisory groups, we come together and present cases. And those aren't recorded because it's all, we want people to feel safe sharing. And also, we don't share personally identifiable information in there of any of our clients or ever. But this is where you can come to get feedback on cases if you are struggling with making a decision, for example. So you can see our events in the upcoming events or in the event space. And then we also have the Cultural and Linguistic Diversity Open Access community where you can post questions, view some resources. Every now and then I'll post some resources that I put together, like one-page reference sheets on how to complete dynamic assessment or myths and facts. That's a really popular one. And this one I put the research in there because something that I found is that when you share information and you don't back it up with research, it feels more like an opinion. So I made a one-page sheet so that people could see that. And then, of course, the courses and workshops. So you can always take a look and see there if there is anything that interests you that you might be able to apply to your practice.
Um, well, thank you, Maria. This is has been really great and very informative. And so I appreciate you taking the time and for the work that you're doing.
Well, thank you so much for having me. It has been an amazing journey to get to this place, and I'm really happy to be able to share my knowledge so that we're not misidentifying culturally and linguistically diverse learners for things that they don't need.
Yes, that is important.
Yeah.